So Assalamualaikum and a very good day. So today I'm going to be presenting about technology in medicine. So the definition is a broad field where innovation plays a crucial role in sustaining health. For example, when it comes to biotechnology, pharmaceuticals, information technology, and also the development of medical devices and equipment. So first off is on information technology and medicine. So these are some of the applications that information technology have in helping enhancing medicine in the first place. The first is called the electronic medical records, or otherwise known as EMR. So basically is that all medical records of patients are saved in just one database. Therefore, it's easily accessible to all doctors. And this is very important in terms of in a situation where a doctor that is in charge of a patient is not available, therefore another doctor has to take their place. So therefore they can gain access to all the information of the patient through the electronic medical records, and so on and so forth. Next is telehealth services. So this is in terms of if um, in terms of like remote access for medical consultation. For example, here patients can hold video conferences with physicians to save time and money and send health information instantaneously to any specialist or doctor in the world. For example, is that a person has a disease that has not been really researched in their home country. So therefore, they have to consult with a specialist that is only available, for example, in America. So instead of flying over there for a consultation, they can easily like use telehealth services to consult with these physicians without spending extra money for their flight costs and spend expenditure and so on and so forth. And this is also very important and very significant for those who live in areas where major hospitals are not situated in. So therefore, it is hard for them to actually go back and forth to hospitals just for a consultation. So instead, they can easily use these services to their advantage. Next, we have mobile technologies such as tablets and smartphones. So how does these help is in terms of mobility of data. For example, if a doctor is if a doctor is on the go, it is much easier for them to like refer to their tablets for the patients records in the database, and therefore they do not have to like go to the file room just to find the patient's records and so on and so forth. And sometimes in situations where they have to do research and studies, for example, like researchers in terms of medicine, they can easily access to these information wherever they are. They do not have to like check out a book or be in libraries and so on and so forth to get this information. Therefore, it makes it more accessible. Next is in terms of medical equipment technology. For example, is robotic surgeries in which minimally invasive surgeries or remote surgery is made possible. For example, the use of um, certain robots to perform surgery on a certain person. For example, a situation that can be given is that in a near future, where doctors can use remote surgery. For example, like the patient is an area where a hospital is not available. So therefore, the hospital, no, not a hospital, of the physician that is a specialist in that area is not available. So instead of like going all the way to the city where this specialist is situated, this patient can easily receive surgery by means of remote surgery from the physicians that is still in their home base. And also in terms of minimally invasive surgeries, is for example, because humans are prone to human errors and fatigues and so on and so forth, the widely known fact that robots and machines are able to do things more efficiently and precisely, it can minimize the invasive surgeries that has to be performed. making surgeries more comfortable and likelihood to be a success is higher. Next is in terms of smart device monitoring system, which can be implanted in body and can detect health issues earlier. So for example, like a person were to get this implant, and a few years if before, and suddenly the physician in charge of this implant of this monitoring system was able to identify at the early stages of cancer due to the smart device monitoring system. So because of this, they can easily call in the patients to consult with them, and earlier prevention and treatment can occur better. Lastly is in terms of 3D printing. So 3D printing can make replacement for organs and better prosthetics which are more flexible and more detailed, and even 3D version of MRI and CT scans for better surgery planning. For example, if a person were to receive surgery that cannot be risked at any form of mistakes, the doctors can print out a 3D form of their MRI or CT scans and locate the places that need to do surgery and locate like possible risk and possible backup plans. So therefore, when the surgery actually takes place, it is more well planned. Lastly is technology and medical research. So medicine is not only about like the doctors like treating the patients. It's also in terms of like research for these medical researchers. For example, is in terms of nanotechnology, which can manipulate individual atoms and molecules in the development of drugs. For example, to make the drugs target the delivery in a more specific way. For example, is that a certain drug, the atoms and molecules can be manipulated better, and therefore the way that they are administered when it already entered the body is more efficient and much more effective due to the technology. Next is neural engineering, which uses technology that can monitor neural system and help researchers to create models for in-depth study. So for example, is neural engineering neural system is basically a system that runs our entire body. So basically, like when researchers can monitor these neural system, they will better understand the workings of the body. For example, like maybe they can understand how cancer works, how cancer can be prevented despite the genetic makings of the individual. And this can all be made possible by neural engineering. And lastly is in terms of higher scale computing power and microscopes, which, for example, can analyze DNA structures to research more in depth. For example, is genetic engineering that is made possible using a microscope that can see the structures of these DNA strands very in detail. So therefore, they can like reconstruct the DNA structure, or for example, of a person prone to for a future infant that is born by two parents with the likelihood of cancer being high. So when they genetically engineer it with the reference of the DNA structure produced by the higher scale microscopes, therefore when the baby is born, or therefore in the future, the likelihood for the baby to get cancer is less likely. So these are some of the technologies that can occur when it comes to medicine. And the benefits are, firstly, it is more time efficient because, as usual, these technology can work 24/7 and in much efficient manner without feeling any fatigue, and the likelihood for them making errors is less likely to occur. Allow more extensive and better treatment, meaning, for example, like with the help of technology, better surgeries, like surgeries before this that is deemed impossible can occur, or even like vaccines for certain diseases deemed impossible to develop can finally be developed with the existence of more advanced technology. And next is make healthcare more accessible. For example, the telehealth services in which people who live in areas where no major hospitals are available, they can easily access, easily communicate with specialists in cities, in places where there are specialists in the first place. And lastly is like related to third one. Okay, so in terms of drawbacks, is that firstly, it is high cost because all this technology requires like extensive funding to develop and extensive funding to maintain. And also the second one is expertise needed, meaning that these doctors have to undergo really really intensive training for them to be able to like use these machines in the first place. And even if in a situation where they are not needed to, hospitals have to recruit people who are an expertise in these machines to maintain them in the first place. And lastly, is that one small technical issue, for example, software manipulation or network interruption can be fatal. For example, in terms of the remote surgery that I talked about, if, for example, in a time critical surgery, and a surgeon were to perform remote surgery on a patient, and suddenly, without any backup, a network interruption occurs. So therefore, the machine cannot function. So in that time critical surgery, the patient's life is in obvious danger. So this is like some of the drawbacks. So with that, this is all I can talk about on the technology in medicine. So thank you.